My name is Leanne Sherrod. I'm a speech-language pathologist and the President and Chief Clinical Officer here at Expressible. Thank you for joining me to learn all about speech delays. You're likely familiar with the term speech delay. Maybe you've heard it from your child's pediatrician or daycare provider, or from other parents and friends. If the idea of your child being delayed makes you feel a bit anxious, you're not alone. Many parents and caregivers have concerns about their child's communication development, and it's not always clear what the next step should be. If you're finding yourself in this place, let's start at the beginning and cover the basics together. We'll begin by talking through what a speech delay is. A speech delay is somewhat of a blanket term. It refers to a child's delay in speaking or when a child has limited verbal speech. A speech therapist is the professional who can evaluate your child, diagnose a speech delay, and provide speech and language treatment. It's important to know that there can be many different components of a speech delay, and speech therapists are trained to identify them. For example, a child may have a receptive language disorder or difficulty understanding what's spoken to them. Or they may have an expressive language disorder, which means they have trouble expressing what they want to say. Other children may be struggling with speech and articulation, which refers to the physical act of producing sounds. A speech therapist is trained to assess and diagnose all of these issues, which is why receiving a speech evaluation early on, also known as early intervention, is so important. So, how do these different speech and language issues relate to a speech delay? Children are expected to meet age-appropriate milestones in all of these developmental areas. If there is a delay in one or more than one of these areas, you could be seeing an overall delay in your child's ability to communicate using words. You may be wondering, how do I know if my child has a speech delay or is just a late bloomer? We cover that question in our video titled, "Does my child have a speech delay?" There we explain the milestones expected at each age and the warning signs to look for. For now, let's look at these milestones more generally. Around age 1, you should begin seeing your child use some single words to label or request items. These are often words that are important to them, like mama or dada, milk, or every toddler's favorite word, mine. By age 2, your child should begin pairing words together to create two-word phrases, like I want or more cookies. By 3 years old, your child should be using pretty well-developed sentences, but you'll likely still hear some grammatical errors. 3-year-olds should be able to participate in conversation, as well as answer and ask basic questions. Take a minute to think about how your child is currently communicating. If they aren't meeting the skills expected for their age, they may have a speech delay, and it's likely that they would benefit from speech therapy. We've produced a series of videos covering speech delays, how they're treated, and even tips you can use with your child at home. With the right information, you can get your child the support they need to become a clear, confident communicator.